So hari ni boleh duduk, besok saya kena pergi KL dah. Sekarang ni tengah busy exam masters. Tiap-tiap minggu kena pergi UM. Until the next minggu lepas dah pergi, minggu depan ni pergi lagi, minggu satu lagi pergi lagi. Then after that exam dia part 2 exam dekat sini, dekat UAE. So saya minta maaf banyak-banyak neglected undergraduate. Dia belajar sendiri lah. Sekarang ni dah harap-harap tak MCO semula lah. Kalau tidak tak graduate pula you all nanti lah. So this tajuk hari ni gynae disorders in childhood and adolescence. Saya nak present. Boleh nampak ke? Tak boleh nampak?
Boleh.
Boleh nampak skrin saya? Okey.
Tapi Prof boleh besarkan slides tu.
Oh, itulah dia bila besarkan saya tak nampak you all dah.
Oh, okey.
Kan?
Tapi tak jelas lah slides.
Ya. Yeah. Yang ni tak jelas ya? Ya? Yeah? Tak jelas ya?
Okey kot. Okey kot.
Okey.
Okey je kot.
Okey ni, nampak?
Nampak.
Okey, kita start ya. Bismillahirrahmanirrahim. Alhamdulillah. Okay, this gynae disorders in childhood and adolescence. For your information, dekat UAE ni, for the gynae disorders ni, gynae disorders in adolescence gynae is a new thing. New thing maksudnya dalam dia berada di dalam kurang pada 10 tahun lepas, dan 5 tahun. So untuk UAE kita dah hantar Dr. Hamizah untuk buat gynae adolescent. So the future nanti Dr. Hamizah akan take over this class, and then kita akan ada gynae adolescent services. And yang dah sekarang ni dia kat UKM, so next year dia akan pergi Melbourne, and then following that she will do the services kat sini lah. And saya harap-harap dia akan jadi HOD masa tu. So this is so for gynae disorders in childhood ni, is actually in a stage of a woman life daripada neonatal period, daripada postpartum first 28 days tu sampai childhood period. Childhood period is until the age of 8. Pre-puberty and puberty period is between 8 to 12, and adolescence period is between ages 12 to 20. Selalunya kalau sampai umur 12, pediatrician akan tengok. Tapi yang perempuan kalau ada masalah gynae problem, that's why dia wani dimasukkan dalam gynae, adolescence period 12 to 20. So kalau adult gynae is 21 and above. Sexual maturity period is between 18 to 15 years of age, and climacterium ataupun sinalism is after the age of 50. Kita tak ubah walaupun sekarang ni jangka hayat umur manusia dah makin bertambah, but age tu kita tak ubah lagi 50 dah, kita dah kata is already old age. Okay, gynae disorders sini, adolescence gynae ni dia fokus pada gynecology among the younger females, less than 20. It is also called pediatric gynecology, and selalunya kes-kes yang ditengok adalah vulva and vaginal problems. And adolescent patient, dia kebanyakannya abdominal pelvic pain and abnormal menstrual bleeding. So kalau dekat earlier childhood, biasanya vulva and vagina, because this is the time that they explore their sexual organs. And the adolescent biasanya abdominal pelvic and abnormal menstrual bleeding. So at birth, the vulva and vagina are well estrogenized. This is placenta estrogen daripada mak dia. The placenta has so high in the estrogen and progesterone. And it's a female hormone kat sini. Jadi anak dia ni the fetus will get estrogen daripada mak dia, and there will be thickening of the vagina epithelium, so that masa lahir tu vagina epithelium dia thick, and then this will protect against any bacterial invasion. Tapi lama kelamaan, after 2 to 3 weeks, placenta estrogen dah tak ada, and they depend pada mak dia punya estrogen from the breastfeeding after that. This will be the hypoestrogenic state, where the vulva skin are thin, vagina epithelium become thinner, and the vulva fat pad disappears. Kalau you tengok budak-budak tu, selalu kita tengok dia tembam kan, bahagian tu pun nampak tembam jugalah kita panggil kalau cakap bahasa Melayu je. And this fat slowly disappears sebab estrogen dia dah tak ada, and vagina entrance becomes unprotected. And at this time, kalau you tengok kalau bayi ni kaki dia terbuka sikit, you can see the vagina opening. And vulval skin is thin, sensitive, easily traumatized by injury, irritation, infection or allergic reaction. And the pH usually 7, and there is no lactobacilli. So it becomes ideal culture medium for low virulence organism, especially dia ni dekat dengan anus, and how the mother clean the genitalia, clean daripada front to the back, tak boleh daripada back to the front, because this will bring whatever bacteria from the anus to the front. And if there is poor local hygiene, and the children yang setahun 2 tahun ataupun the almost 3 years old tu, you will see that they are exploring their genitalia. Kadang-kadang kita tengok adik-adik kita atau anak-anak kan, sambil dia nak bangun pagi tu tangan dia dekat dalam seluar. So this is something what we call oral genital phase. Dan the oral genital phase ni perlu diberi perhatian sebab kadang-kadang mak atau just marah-marah je, tak boleh buat ni, tak boleh buat ni. And in the end it will have a psychological impact to the babies. So in future nanti mungkin dia tak suka perempuan, dia tak suka lelaki, and they are the sexual deviant. So their oral genital phase ni is important. Then they get urinary incontinence at night, and this will cause further infection to the genital. Okay. When you take gynae history in them, selalunya we take from the parents, and then you want to talk about the genital area, sensitive. These are sensitive areas that it will cause anxiety and cause is quite, at times it's quite difficult to get the history, especially if you think about incest, hubungan rambang ataupun the sexual abuse, then susah nak tanya kalau especially if it involves family. So sometimes we want to take history also, it cause anxious in the parents. Contohnya kalau anak tu jatuh and then there is trauma at that area, so the parents will, the first question mak dan ayah dia tanya, hymen still intact or not? So they are so anxious about that. So examination of the prepubertal child requires cooperation from both the patient and the mother, and requires extreme sensitivity if a successful examination is to be carried out to allow examination. So when we do examination, we have to talk to the mother, Lepas tu we talk to the child, and selalunya saya akan cakap pada anak-anak ni, saya kata, saya doktor, saya akan buat pemeriksaan, kita tengok di luar saja, kita tak sentuh. Kalau saya nak sentuh, saya beritahu saya kata. And then saya kata, kena ingat hanya mak dan doktor saja boleh pegang bahagian tu. Orang lain tak boleh. So because nanti dia akan dapat, okay tak apa aku boleh kangkang and then bagi siapa-siapa je usik bahagian tu. So they need to understand also. Kita kena ajar dia, these are the areas that nobody can touch kecuali dia, mak dia ataupun mak dia bawa jumpa doktor. Not even, sometimes kita cakap not even the father to touch that area. So then external examination ni minimal handling, gentle traction on the buttocks to expose vagina orifice. Kadang-kadang kita just hold the macam you check untuk you punya hip dislocation tu dalam dekat fetus tu kan, dekat baby tu, macam you check hip dislocation, just that you handle gently and then you naikkan punggung dia sikit, you just push the buttock, then you can see the vaginal orifice will be exposed. Sebab masa-masa ni they don't have enough estrogen. So then sometimes we take specimens using syringe, flexible catheter, swab into, we just put the, if necessary, kadang-kadang in the older children kita masukkan swab into the hamil orifice without causing tear to the hymen. And in adolescent vagina examination should be avoided. We should macam mana pun we try to avoid unless there is real necessary to examine the vagina. Symptoms of this, the symptoms that they usually present is vulvo-vaginitis, that they will get vaginal discharge and pruritus. And second is vaginal bleeding. The third yang selalu mak-mak akan bawa, satu hari mak tu bawa kat kita and kata, there is no vaginal opening. This is vaginal synechiae. And the other symptoms yang the fourth symptoms yang usually they are brought to us is amenorrhea, primary amenorrhea. Dah umur 11 tahun tak datang period. But amenorrhea you can wait sampai 14 tahun kalau sekiranya ada secondary sexual characteristic. Maknanya breast bud ada, pubic hair ada, axillary hair ada, but tak ada menses. You can wait sampai 17 years old. Tapi kalau dia 14 years old without breast bud semua tu, you have to bring them earlier. So vulvo-vaginitis, nampak slide-nya? So in vulvo-vaginitis, nampak vulvo-vaginitis selalunya in children ni is because of chemical irritant. Is because of kadang-kadang mak-mak tu nak letak macam-macam. Kalau mak yang obses sikit, dia cucikan dengan macam-macam. All these, actually the cleaning is just need water saja, warm water and clean that area. Tak payah sabun banyak-banyak because that area has its own bacteria that protect the skin. The normal floral contohnya Staph epidermidis, diphtheroids, lactobacillus and anaerobic bacteria, Bacteroides. Then you don't have to give any treatment. And chemical irritant, kadang mak ni dia letak talcum powder, and it is found that talcum powder kalau you letak dekat baby ni atau children ataupun it brings up into adolescence and adulthood, you letak talcum powder, it is related with malignancy. So not to put anything unnecessary. So the common infectious organism is Strep pyogenes, Staph aureus, Proteus mirabilis, Neisseria meningitidis, Streptococcus pneumonia, Enterococci, E. coli and Gardnerella vaginalis. Candida albicans, and if you find Neisseria gonorrhea, Chlamydia trachomatis and Trichomonas vaginalis, these are showing that budak ni kena sexual abuse. More further interrogation and investigation need to be done. And kalau okay, we go to the I'm showing gambar-gambar yang teruk sikit. So jangan terperanjat. So this is vulvo-vaginitis of HPV virus. Kalau you tengok HPV virus is actually kalau during the early stage of infection, kita akan tengok budak tu garu-garu gatal. But when we check, there is nothing, and then you discharge them. But after sometimes, selalunya lepas seminggu dia gatal macam tu, then you come call them back again, and then you start to see the cauliflower shape of growth. This is human papilloma virus. Saya pernah jumpa sebesar ni pada seorang wanita lah. Masa zaman tu she had very huge masa dia nak beranak dah. She had very huge sini, and usually kalau mak dia ada, we don't allow vaginal delivery because HPV virus ni, you just imagine kalau mak dia ada dekat vagina and the baby comes out through the vagina and inhale ataupun the fluid gets into the trachea dengan tu kan. So dia orang boleh dapat laryngeal warts. And laryngeal warts after seminggu 2 minggu tu budak tu tak boleh bernafas, and then you see warts besar dalam tu. So this and it's difficult to treat the laryngeal warts. That's why the HPV virus kalau mak dia ada, kita tak bagi beranak biasa. Even the herpes simplex kita tak bagi banyak biasa because that will cause cephaloencephalitis. And like the other thing is that sometimes we see lichen sclerosis. Okay, then we see they come with vaginal bleeding. So vaginal bleeding kalau dekat orang-orang Kelantan kan, orang Kelantan bila musim banjir tu dia suka dia pergi mandi air sungai, air yang bertakung-takung tu kan orang Kelantan. Macam tak ngaku pula orang Kelantan ni. Bukan orang Kelantan aja, orang Oman. Masa saya duduk Oman kan, di Oman ni bila hujan je dia happy, dia lari keluar mandi kat luar tu. So, sama juga orang kita. But kita sini banyak lintah, leech. So you see leech, bila ada vaginal bleeding, sometimes what happen is that we see ada foreign body trauma or sexual abuse. These are the things that kita ni. Kalau dekat Kelantan tu banyaklah kes yang bila lepas musim banjir tu they come with vaginal bleeding, and then when we do vaginal examination ada leech. And this leech ni dia boleh masuk ikut dalam vagina and somehow get tembus to the cervix and get into the abdominal cavity. And yang keduanya vaginal bleeding due to trauma. Okay, vaginal bleeding due to trauma. This I want to show you. This is the normal clitoral hood. Clitoris kat sini, then that's the normal clitoral hood. And this is a normal shape of hymen. Kalau hymen macam ni, this is we call semilunar hymen. Dia intact, but the bleeding is from atas sini. And compared to this, these are photos of children, the girls yang biasanya injury macam ni when dia naik basikal. So injury yang macam ni biasanya dia naik basikal, and the pedal of bicycle tu terbalik, and pedal tu tekan dia terhentak dekat the pedal of the bicycle. And they will usually be presented with huge hematoma. And kes-kes yang macam ni selalu mak dia akan datang tanya whether hymen is intact or not. And then in such case kadang kita kena explore, tengok any further bleeding kat dalam. Usually we bring them to OT under GA and for proper examination. sometimes with this huge hematoma ni is just external, dia bukan ni. But if the child is brought by anyone, even the father ke mak dia ke ni, with trauma at the vulva area ni, kita mesti rule out sexual abuse. Because there are cases of sexual abuse, especially if they presented with discharge, and we have to look at other side of the body, of look for evidence of any sexual abuse. And usually sexual abuse in children, in small children, the assailants are known people to them. Known people. Abang dia, bapa dia, pakcik dia, these are childrennya tu. Children kadang-kadang adik-adik nah bagi gula-gula sikit, and they come and follow these those yang dia kenal kan, and people take advantage on them. So this is what happened to them. Okay. This is what we call some vaginal bleeding due to neoplasm, either hemangioma of the vulva or sarcoma bothroides of the vagina. Sometimes they can have functional ovarian cysts. They are somehow the HPO axis is being stimulated, and they can have functional ovarian cysts. But if they have vaginal bleeding, we must always check for any ovarian tumor. Granulosa cell tumor of the ovary, this is producing estrogen that will cause endometrium to be stimulated, and will become proliferative, and later on will have something like menses or vaginal bleeding. Granulosa cell tumor of the ovary is the usually occurs in extreme age group, very young or very old women yang dah menopause lama. So this is sarcoma bothroides of the vagina. Dia macam grape-like lesion, and this is a case of a 14-year-old with vaginal bleeding and grape-like mass, and this is after hysterectomy. Because it's malignant, then have to do hysterectomy. This is bothroides at the cervix, and this is bothroides at the vagina. Okay, the other cause of vaginal bleeding is urethral prolapse. The urethral prolapse, this is the surface of the urethra. They prolapse out, and it can be congenital or it can be acquired. And then the premature menarche. Menarche usually pada usia berapa? Fitria menarche at what age, Fitria?
Menarche usually like around the earliest is at the 9-year-old.
9-year-old. So if you have menarche at less than the precocious puberty, bila?
Because less than I cannot remember. Sorry.
Siapa buat ONG ni? Tak ada orang buat ONG. Razis. Haikom Razis. Apa ni? Ingat. So go and check when is the when you say that someone is precocious puberty. Vaginal bleeding can be due to hypothyroidism juga. This girl is Lina Medina. She's from Peru. In 1930 something, at the age of 6 years old, she was brought to a doctor with abdominal distension. So bila masa zaman dulu kan buat tak ada scan sangat, so you buat X-ray. So X-ray was taken, and to their surprise, there is baby inside and she's pregnant, and she's actually have breast development, and she was pregnant at the age of 6. So they did cesarean for her, and this baby was brought up together with her as though that is her brother. Yeah? Tapi he died at the age of 30 plus because of bone cancer. So it was believed that probably masa tu mak dia kena buat x-ray kan. X-ray taken, and then orang tak percaya, buat lagi, and then it was said that most likely that the child had CA, bone CA, because of the exposure to the x-rays. So this is Lina Madina. If I'm not mistaken, she's still alive. Okay. Then the labia synechiae. As mentioned, just after birth, because of the estrogenized, usually you can see it's thick, but most of the time the vagina is open, yeah. But after sometimes estrogen tak ada, then slowly it become the labia, both the labia minora akan melekat. Dia melekat and there is no opening, and sometimes you can just see small opening of for the urine. Yeah? And treatment dia nak buat macam mana ni? Siapa ada kat sini? Fikri, Syazwan Fikri. Treatment nak buat apa ni Fikri?
Operating.
Yeah? You operate, you just potong macam ni lah. Remember the cause is hypoestrogen. The cause is hypoestrogen. So you just give her estrogen cream. Your Primarine cream, sapukan aja kat sini. Cakap kat mak dia, sapukan kat sini hari-hari. And then you will see that after 1 or 2 weeks, dia akan terbuka. Bila dia terbuka, then you see this is the clitoral hood. Clitoris is inside here, and bawah ni ada lubang urethra kat sini, and this is the vagina. And this is the vagina. It's a ring hymen. Dia bulat macam ni. Macam saya tunjuk tadi, is semilunar. So hymen ni ada banyak-banyak jenis. So labial adhesion or synechiae, rawatannya dengan estrogen cream. Okay, like this one, 4-year-old was brought, mak dia nampak macam ada 2 lubang kencing, but it's actually because of because of the labial synechiae, nampak macam double dia punya ni, but when we put estrogen cream kat situ, then dia terbuka, and this is jenis hymen yang agak tebal. You don't see the opening, but it's a thick hymen. Okay. Then they can come to you with heavy menstrual bleeding. The first 2 years after menarche, 55 to 82% cycle are anovulatory. Initially they are anovulatory, so they usually dapat irregular menses. That's normal. 95% of normal uterine bleeding in adolescents are due to anovulation. Bleeding disorders, von Willebrand disease is 5 to 36%, and platelet dysfunction 2 to 44%, thrombocytopenia 13 to 20%. Glanzmann's disease ni, I met such patient when I was in Sabah. Saya pergi untuk congress, and in the congress we managed to see group of it's hematology punya congress, International Hematology Congress in Sabah, and somehow they call all patients yang ada hematological problem datang ke that ni. So I met them, and one of them had Glanzmann's disease, and she's actually, when she's menses, dia akan pouring. Sekali dia datang period, almost sebulan tu tak habis-habis period dia berhenti. It was just pouring and pouring. And one day, she had an accident near Temerloh. near Temerloh, dia accident. That time umur dia berapa after got married. And but the husband is very nice, very responsible, taking care of the wife. Sangat-sangat baik husband dia. Saya jumpa sekali. And husband dia cerita kat saya, when they were travelling and they had accident near Temerloh. And a wife was admitted to Temerloh. And Temerloh kata, oh, we need to open the abdomen because they suspect abdominal injury. So husband dia kata, no, my wife ada Glanzmann's disease. Tak boleh buat kat Temerloh. Lepas tu the surgeon masa tu quite angry lah. Dia kata dia nak buka urgently. And then when they open up and they couldn't stop the bleeders. And she need berapa, I can't remember dah sekarang ni, 50 ke berapa puluh pint darah bagi kat dia. And then after the surgery baru husband dia kata, the doctors kata, oh, we didn't know actually Glanzmann's disease tu apa. So unnecessary, sometimes you open up and cause a problem to the patient. And she was asking me, doktor boleh tak saya mengandung? Saya kata, kalau you mengandung saya tak berani nak ambil because we definitely will lose you once they deliver tu. She's advised not to get pregnant. And okay, this some history that you need to take. And for patient A minor, 14-year-old, if no secondary sexual characteristic, this is the time that kita kena check. And kalau dia ada secondary sexual characteristic, we can wait sampai 17 years of age and look at the tenor staging. And satu lagi yang saya ingat, case sexual abuse. Sometimes kalau patient datang with vaginal bleeding and areas of trauma, satu, we have to rule out masturbation. Budak-budak lelaki sini Qayyum
Yes,
Qayyum Rosli. You rasa perempuan ke lelaki masturbate?
I think both masturbate. Both gender masturbate.
both gender masturbate. So dia punya oral genital phase tu nak kena jaga betul-betul tu. And then we have to talk to these children. Kata, okay, this area dia kau punya is a precious area. Dia Allah suruh jaga bahagian tu kan. So kena jaga sebaik-baiknya and tak boleh orang lain pegang ke apa-apa. And then sometimes these children dia over bila dia dah rasa macam dia sentuh-sentuh diri dia and then dia rasa pleasure. And then dia akan ulang and in the end dia akan jadi habit. So I got, when I was in the Quantal Medical Center last time, I got a child, a 2-year, standard 2, 8-year-old child was brought to me by the parents. Parents dia kata tak sanggup dah tengok anak dia. Dia jumpa bucu table pun dia pergi gesel-gesel kat situ. Dia nampak apa dia gesel. Budak ni mungkin tak tahu tau. Budak ni mungkin tak tahu benda tu salah or apa ni kan. It's just that dia rasa pleasure. So dia berterutan macam tu. So these are children yang kita kena tackle. And probably saya selalunya slowly advise counselling. And then yang kita tak boleh nak then kita bawa jumpa psychiatrist. So kalau ada child psychiatrist, that's even better. And and saya remember ada satu rape case. Rape case that time was in KL. Dah lama dah tu. And this child, they found that this girl was sexually abused and raped and found dekat bilik hotel sewaan. And bila orang tengok tu orang kesian. Everyone pergi kat situ, pergi pegang-pegang nak lepaskan budak tu kan. Then the evidence hilang. And sebab tu kalau you tengok dalam CSI punya cerita kan, dia tangan dia dalam poket and don't touch anything kan, because you might lose evidence. So evidence hilang and sampai ni tak buang kes saja, tak boleh cari who is the assailant. And imagine kayu yang tebal panjang tu was pushed into her vagina, and when they do postmortem it's until her liver. When it reach the liver, and the liver rupture tu yang menyebabkan dia mati. So it's a very traumatic incident. And sekarang ni pun I'm just afraid for another MCO lah. MCO ni ada bagusnya, ada yang tak bagusnya. Yang tak bagusnya for those rumah yang tak banyak bilik. Rumah yang tak banyak bilik, and macam satu rumah satu bilik aja macam tu, and so many people kat situ, and then there are anak-anak ni yang dia tak tahu mana nak lari. So masa tak MCO, dia orang boleh lari daripada rumah pergi ke supermarket, pergi ke situ untuk lari. But ada complaints that now MCO, the father is at home, father dia yang makan dia, and every day benda tu berlaku and tak ada siapa yang boleh selamatkan dia. So that's the disadvantage of MCO ni pula, yeah? For such family lah. So jangan sangka kita dalam kita punya ni pun kadang-kadang ada yang pernah sexual abused, being abused, and ada yang by family members, ya. And ada yang a few years back saya pergi tengok dekat ni, visit the home and how the home situation, dan kita tahulah macam mana dia actually tak ada tempat nak lari budak-budak ni. Okay, the conclusion is common presentation is vulvo-vaginitis, vaginal bleeding, labial synechiae, heavy menstrual bleeding, and amenorrhea. And when the trauma, always rule out sexual abuse. And kita ada hak untuk bila seorang budak tu dibawa pada kita dan kita tengok, oh kita sangka ini sexual abuse. Dan kita boleh cakap, kita tak nak examine dulu, I don't want to examine, kita kena report polis dulu. So with report polis, sebenarnya kita tak boleh check orang punya hymen tanpa ni. So kena ada report polis, dan polis kena ada bersama masa kita examine. Otherwise dia akan dibuang kes saja. Sebab dia akan kata, oh because of your examination, you sendiri yang perforate the hymen. Yeah? Sebab tu kalau any sexual abuse, kita tak boleh examine sendiri-sendiri. We must have police report and police command that we need to do the examination. And selalu examination ni we try to do non-invasive investigation. Yeah? Non-invasive. We don't kecuali kalau kadang-kadang foreign bodies, children dia rajin juga masuk macam-macam dalam tu kayum. The girls, dia masuk macam-macam benda yang you tak boleh imagine kadang. Yeah? Sama ada tadi tu lintah, ataupun they put themselves, kadang-kadang bateri yang masuk, and lipstick case yang masuk dalam tu. So it's either sexual explore, they are exploring their sexual genital punya ni, ataupun dia kan looking for pleasure macam tu. So kadang-kadang banyak benda yang kita tak sangka-sangka dalam tu. So for such cases kadang walaupun hymen dia dah intact, hymen dia dah ni, but we try not to make things worse. Dan selalu kita akan guna a scope. Kita masukkan scope dalam vagina without further tear benda-benda lain, and then just remove it macam tu. So it must be non-invasive. And extra empathy and sympathy with young patients, especially in sexual abuse, and examination must always with the mother around. Mesti ada mak dia ada kat situ. And for the doktor-doktor lelaki, saya nasihatkan nurses mesti ada kat situ. Yeah? Any questions? Anis Akila, ada question?
No, Prof.
Tak ada? Okay. So tak ada, kita call it an end. Faris tak ada question, Faris? Saya ada nampak
Tak
sini
ada, Prof.
macam apa, Datuk Vida kat sini. Nur Syaliati Eriza. Syaliati?
Ya, Prof. Ya, Prof.
Saya tengok gambar ni macam Datuk Vida pula ada ni. Ada crown tu. Betul ada crown eh? Baju pengantin eh?
Ya.
Okay, alright. Oh, you dah kahwin lah. Ada anak
Ya,
dah?
Prof. Currently expecting.
Expecting. InsyaAllah, Alhamdulillah. Hope apa ni? Semua berjalan baik ya.
InsyaAllah.
So ada question? So untuk final pro, just baca-baca yang ni. Okay, the orogenital. Prof, can you explain the apa ni orogenital phase? Mana soalan tu tadi tak nampak?
Prof.
Hmm?
So the question is, can you explain more about the orogenital phase until what year is considered as normal? Because you said just now, kalau budak-budak tengah main, jangan halang, something like that, is it?
Tak, dia bukan kita, the orogenital phase ni macam dia very young age macam tu. Umur dia 2 tahun, kadang dia dah pandai masuk tangan dia dan seluar lah. 2 tahun sampai the preschool lah. This is orogenital. Masa permulaan dia banyak explore dia punya mulut tau. Bla 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 bla, dia bercakap macam tu. This exploring the mouth actually, the oral lah. Lepas tu then dia explore dia punya genital pula, the genital punya face. So kalau kita duk marah-marah dia, kadang-kadang cara kita tegur dia. And then kita marah, situ kotor, tak boleh gini-gini ya. Because I have a patient yang selalu kena marah. Masa kecil-kecil memang bila kita ambil history dia balik, is actually mak dia selalu inhibit kawasan tak boleh ni, and apa ni, macam-macam lah. So in the end, you tengok she cannot consummate the marriage. Maksudnya dia kahwin tapi tak boleh ada sexual intercourse. They cannot have sexual intercourse. So zaman-zaman dia masa ni, I think probably the person to us is probably psychiatrist lagi bagus lah untuk you tanya pasal this orogenital phase. In psychiatric book pun ada orogenital phase. It's young children that cara you nak tegur dia and then nak beritahu dia tu, it must be in a proper way supaya dia dalam fikiran dia tak memandang benda tu tersangat kotor dan tak boleh diusik, sehingga bila dia kahwin nanti pun tak boleh. Ya? I have a patient yang kahwin, kalau orang Melayu lama dia tunggu, lelaki Melayu sabar lama tau. Lelaki Melayu yang sabar saya tengok sampai 9 tahun pun dia tunggu. Baru datang jumpa doktor. Yang Cina, yang India patient saya 6 bulan kahwin dah datang. Yang Cina lagi baru balik honeymoon dah datang jumpa. And yang lelaki, yang ni masalahnya lelaki tak jumpa cik lubang. And sampai saya kata, you tahu tak dia ingat lubang tu mesti terbuka besar macam tu. So dia ni. Tapi yang perempuan, yang the Indian tu 6 bulan kahwin, and bila husband dia nak dekat dia tutup kaki dia. This is vaginismus. These are all vaginismus ni kebanyakannya related to psychiatric problem in the lady. So you kena explore dia punya ni. So yang the Indian ni daripada kecil dia kata mak dia takutkan dia, and the kakak dia pun takutkan dia about sexual. And then yang di Malay tu is actually masa zaman dia kecil was raped. She was raped. And masa dia very young age, she was raped. And tu yang jadi takut bila she will think that macam seolah-olah pisau yang nak masuk. So it's interesting to read about this siapa tadi, Iqlil Najah. So the orogenital phase is during masa dia childhood ni.
Thank you, Prof.
Okay. Ini soalan tak ada? Selepas
Prof,
ni ada
Assalamualaikum Prof.
Waalaikumsalam.
Prof, I just want to ask one question. As we know that in Malaysia, culturally we perform female gender mutilation since birth. So is it acceptable as it is a form of mutilation, and is there any role in adolescent gynae to prevent that?
Okay. Kalau you cakap genital mutilation, dia ada banyak stages of genital mutilation. And for your information, saya flagship bawa ketua untuk flagship Baby Friendly Hospital Initiative. And di bawah Baby Friendly Hospital Initiative ni, ada beberapa perkara. Satu, kita nak bawa accreditation for the hospital to get BFHI status. Rakan bayi, hospital rakan bayi. And keduanya, saya nak membentuk Halimatus Sa'diah Human Mob Center. And ketiga, yang tu saya letak bawah Dr. Said in charge yang tu. And yang untuk BFHI is Prof Azam in charge tu. And kita ada satu lagi ni, kita letak circumcision in female. So Prof Zarina sebenarnya tengah kaji tu sama ada circumcision tu bagaimana. Kalau bila tanya Mufti kata memang ada circumcision in female. Tapi macam mana nak buat, tak seorang pun tahu macam mana nak buat. Kalau ikut hadis Rasulullah, katanya dia punya words tu saya dah lupa, tapi dalam bahasa Melayunya dia kata merapikan tu. So apa maksud merapi tu kita tak tahu. Mufti pun tak tahu apa ni. And in Malaysia, we are doing the gentlest form. You potong sikit aja kulit ujung klitoris dia, ataupun sekarang ni dia orang cucuk aja. But the technique is questionable. Prof Zainal tengah cari tu teknik, apakah teknik yang dari segi Islam ada ke tidak. Dan kita jumpa apa yang kita panggil clitoral hood. Kalau merapikan, is actually the clitoral hood tu yang kita nak kena rapikan. Supaya dia punya clitoris tu a little bit exposed, and that will give sexual pleasure to the lady and to the husband. So tapi kalau sekadar cucuk tu dengan yang itu, it is not. So might as well jangan buat langsung. Tapi kita tak boleh lah nak bagikan ni, sebab Mufti baru ni pun cakap it is something like sunat muakkad, sunat yang dituntut. Tapi cara pelaksanaannya kita tak ni. Jadi genital mutilation yang orang lain buat, macam saya tengok patient-patient saya yang datang beranak kan, orang-orang Sudan, orang-orang Afrika macam tu, how they do dia punya circumcision is very different. Circumcision dia potong daripada atas ke bawah, and then dia rapatkan aja kaki budak tu sehingga dia punya labia majora ke atas tu akan tutup dia punya klitoris. Dia akan tertutup, dia akan nampak macam anak patung tu, anak patung yang dulu-dulu punya anak patung kan, tak ada seks bawah tu kan, dia tutupnya macam tu. And dia akan ada lubang kecil saja untuk kencing. And lubang kecil ni lah dia untuk sexual also. And imagine it's very painful. So patient yang datang kat saya untuk beranak, dia ada lubang sebesar tu je because labia majora dia semua dah bersatu macam tu. And then kalau nak beranak, saya cakap kat dia, do you want me, I need to cut atas, saya kena cut bawah. And then selepas cut, saya tanya husband dia, you want me to repair as it's supposed to be, ataupun nak tutup balik macam tu. Bila kita tanya wife tu kata is actually sex is very painful to her. Saya tak tahulah Rusli, Qayyum. Mungkin lelaki yang ganas-ganas tu mungkin dia suka perempuan menjerit sakit tu. Qayyum.
No, Prof.
So this is Anika. Answered you tak?
Yes, Prof. And you're answering my question very clearly.
Because in Malaysia kita punya cara tu cara yang sangat halus, tapi cara halus tu betul ke tidak yang dituntut. Itu yang kita nak cari tu. So Prof Zalina dia tengah mencari benda tu lah. Dia nak buat benda tu, nak cari grant. So dia kena dapatkan grant daripada, dia tengah dapatkan grant daripada rektor dengan Jabatan Agama Islam lah. Kalau dapat lah, then we will proceed. And mungkin daripada keputusan tu tak perlu langsung dengan cara yang kita buat. Mungkin cara kita buat tu salah tu. Just you cucuk aja keluarkan darah. This is banyak yang buat macam tu ni. Okay.
Thank you, Prof.
Okay. Okay, sudah ya? Okay, Assalamualaikum. Thank you, all the best for everyone, and then stay safe, jangan keluar-keluar ya. Tak perlu jangan keluar. And hopefully your batch boleh go and seek for exams. Kita dapat surat yang terbaru ni, the new comers are not allowed to enter. Yeah. So harap-harap you all dapat sit for exam. Okay, all the best.
InsyaAllah, amin.
Thank you, Prof. Thank you so much, Prof.
Thank you, Prof.
Thank you, Prof.
Thank you, Prof.